Let's now get started, and 8 more people have died from COVID-19 in the country, the highest number of fatalities in a single day, raising the death toll to 181. Health CS Mutahi Kagwe said one of those who succumbed to the virus was a medical doctor, Kenya's first case of a healthcare provider. During the same period, 473 new infections were reported, this also being the highest number of cases to be recorded within 24 hours, and again raising the country's caseload to 9,448. The development coming as the Minister of Health opted for home-based care as a cheaper way of managing COVID-19 patients.
We have today, for the first time, lost a medical doctor to the coronavirus disease. I'm deeply saddened by this, particularly so because she contracted the virus while working to save lives of others who had contracted the virus.
Health Cabinet Secretary Mutahi Kagwe would ask for a minute of silence in honor of a fallen soldier in the fight against coronavirus. The death of Dr. Doreen Adisa Lugaliki to COVID-19 on Friday is Kenya's first death of a medical doctor.
It is always painful when life is lost, but even more painful when it is a front-line worker, and more so when it comes on the line of duty.
76 more patients have, however, been discharged, raising the total number of recoveries to 2,734. Health CS Mutahi Kagwe, who was in Kilifi to assess their COVID-19 preparedness, further revealed that 473 more people have tested positive for coronavirus in the last 24 hours, bringing the total to 9,448.
Our numbers of those who have tested positive have continued to rise above what we recorded yesterday. Out of a sample of 6,979, nearly 7,000, a total of 473 people have tested positive to coronavirus disease.
Kwa sasa tangu tupate kisa cha kwanza, kaunti ya Kilifi imeandikisha visa 71 kwa jumla, kutoka mwanzo mpaka hivi leo tunaposimama hapa. Kati ya visa vile 71, watu 61 wamepata fueni na wamerudi majumbani.
Acting Director General in the Ministry of Health, Dr. Patrick Amoth, on his part, emphasized on the need for Kenyans to embrace home-based care owing to the cost of managing COVID-19 patients, a responsibility left to the national government.
The cost of management of somebody who tests positive for COVID, who is basically asymptomatic per day, is about 21,300 Kenya shillings. If you have a mild form of the disease with mild symptoms, maybe a mild cough or just slight difficulty in breathing, then that puts you at 21,400 shillings per day. If you have a severe form of COVID, in which case you require supplemental oxygen, that figure jumps to 51,000 shillings per day. And if you require ICU critical care support, including intubation and ventilator support, the figure goes to 71,000 per day.
The number of new infections in the country has been steadily rising, with 42 out of 47 counties reporting cases in their regions. Nairobi leads with 5,188, followed by Mombasa County that has 1,720 coronavirus cases. Purity Museo, Channel 1 News.